And one, I like to start with so many elements at play. Where does technology fit into the future of healthcare?
So it's a great question, and it's why I started off the talk to say I didn't go to medical school to play with technology, right, to work on technology. Went to medical school to be a doctor, and I think that's really actually the biggest thing we have to remember is not missing the forest for the trees, which is what do we do in healthcare? Where do you sit within the healthcare industry? If it's on the payer side, if it's on the provider side, understanding the forest that you're in is first fundamental. And then the technology is there to enable that, right? It's there to enable whatever piece of the ecosystem you're in, but always remembering who is the end user and who are you serving. You know, when the EHR revolution happened, every EHR company, every IT person I ever talked to, and this is me working in big tech, would say, you know, those damn doctors, they just don't understand technology. Why won't they use it? They just don't like change. Well, spoiler alert, doctors love technology. They love CT scanners, MRIs, stethoscopes. We are the king of cutting edge research, kings and queens of cutting edge research. But only if it works, right? Only if it works. When you as a product person blame the end user, when you as a technology expert blame the end user, you have already failed. Because you should understand your end user so well that they would adopt your technology just like an Apple product out of the box. Why do I have to be trained on an EHR for hours and hours and hours? Because it is not intuitive. Nothing about it is intuitive. And it takes me 6 clicks to do the thing that used to just take me 1 stroke of a pen. So understanding that technology is not the issue. You must understand where you sit in healthcare, and then what is the problem you are solving that technology will improve, or, as it has happened too often in health tech, hinder. And really, really understanding that. And it's not the popular opinion as I sit here and the crowd is very, very quiet. But it's the truth. It is the truth. And in any doctor's lounge across any hospital in America, we doctors literally give each other what we call workarounds. Hey, Lorenzo, I got this workaround for lupus. Do you want it? It takes 3 clicks instead of 5. It's like a drug deal in the doctor's lounge. And we literally work around the IT departments to get our jobs done. Now, that's not a great compliment, right? IT needs to be in that doctor's lounge. They need to understand why those conversations are happening and say, you know what? Now I get it. Thanks for your time, doc. Now I understand. There has to be a partnership. We do healthcare in silos. We do it great in silos. Tech talks to tech, and they're like, wow, I really like your thing. Doctors talk to doctors. You got to find that marriage. You got to work across the silos. Interoperability, you got to work across the silos, and that's the only way you do it, by really understanding the ultimate end user. Is it the doctor? Is it the patient? It's one of them. Somewhere in that ecosystem, you are talking to an end user, so you need to understand them. That is first and foremost.